A new treatment option is available for some symptoms of menopause. Here to tell us about the findings and what's available to patients, Dr. Barbara Dupree from Holland Hospital Women's Specialty Care. Doctor, thanks so much for being here.
Yeah, thank you for the invitation to join you.
I'm so glad to hear about this. Tell us about this new treatment option and what that means for women going through menopause.
Yes, so just last month, a new medication was approved for treating menopausal hot flashes, or what we call vasomotor symptoms, VMS, and it is non-hormonal. So it's a first in class. It's a brand new drug working in a very different mechanism from anything we've had before to help menopausal women address their VMS or hot flashes and night sweats.
Because most of that in the past has been used with hormones, and that's been a problem for some women who weren't able to take that.
Exactly. So our really mainstay of treating menopausal symptoms, a broad array of symptoms, has been hormone therapy. And we've learned over the years that most women are safe candidates to initiate and use hormone therapy, but there's still a lot of fear and concerns around hormone therapy, and there are many women who maybe have a contraindication to using it. So we're really excited that there's a new non-hormonal treatment option. It's oral once daily, and I think what's good news is that the research has focused on trying to find a safe alternate for women outside of hormone therapy, and they've come to better understand the mechanism of action of hot flashes and night sweats, and this treatment is targeted specifically at the area of the brain that hot flashes originate.
So this discovery came from a national study that was actually launched in the 90s, so it's been studied for that long.
Well, the study I think you're referencing is the Women's Health Initiative. That was launched in the 90s and published in 2002, which really caused the ripple effect of having concerns and fears around using hormone therapy. I think as a result of that, a lot of additional research and investigation has gone on to try to help solve the symptoms of menopause in a way that's not hormonal, because at that point in time, many women abandoned hormones. Many physicians and providers abandoned offering their patients hormones then as well. So there's been intense research and trying to help find other solutions to help women address their menopausal symptoms.
Right. And over the years, of course, it has become more common to talk about this, because for years women didn't talk about it, and that's an important step as well.
Yes, I think menopause in general is enjoying a moment. A lot of, very visible women from all walks of life have come forward to share the difficult symptoms that they're experiencing. It has a really large biologic, psychologic, social impact on women. It's actually been estimated to impact about $2 billion a year in lost profits from menopausal women and interrupting their workplace and, trying to navigate this. So I think we're recognizing that we really do need to find safe solutions to offer women so they can be their best selves during this time of their 50s and 60s, when generally they want to be very productive and contributing to society.
So if women are looking for this new medication or others, where can they turn?
Yes, the name of the medication is Veozah, V-E-O-Z-A-H, 45 milligrams one daily. It is available in pharmacies. As a matter of fact, I saw my first patient back. She started 10 days ago. I saw her yesterday in the office, and she's having a remarkable response. So I was really grateful to hear her out of the gate. Already within a few days, she was sleeping better and having significant improvement in both intensity and frequency of her hot flashes. So it's in pharmacies, and hopefully your primary care physician or gynecologist will soon become familiar with it and comfortable prescribing it.
All right, good. Well, great information, Doctor. Again, thank you so much for being here today and talking with me.
Yeah, thank you for the invitation.